Hello everyone, my name is Sadia and I'm a research associate in the Department of Community Health Sciences at the University of Calgary. I recently defended my master's thesis at the University of Calgary on patient and caregiver experiences informing an early palliative care pathway. We know that patients with advanced cancer often have trouble coping with their symptoms, and therefore a palliative approach to care is recommended. Palliative care is patient and family-centered care that improves the quality of life of patients and their families facing challenges associated with their illness. It can mean attending to their physical, spiritual, and psychosocial needs. In Alberta, however, we notice that the delivery of palliative care is often inconsistent, there being many late palliative care referrals being associated with aggressive end-of-life care, which means repeated hospitalizations at the last month of life, emergency department visits, as well as dying in hospital. Therefore, to address this, the palliative care early and systematic team developed an early palliative care pathway for advanced colorectal cancer patients, addressing these four essential components: understanding the illness, coping with it, attending to symptoms and functional status, advanced care planning and patients' preferred method of decision making, as well as the coordination of care. Our study aimed to incorporate the experiences of patients living with advanced colorectal cancer, as well as their family caregivers, to inform the refinement and development of this early palliative care pathway for advanced cancer care. We conducted a qualitative and patient-oriented study, and we conducted two qualitative studies. We did one before implementation of the early palliative care pathway with patients and caregivers, and one afterwards, in order to make comparisons. In our first qualitative study, prior to implementation of the early palliative approach to care, we wanted to understand what the current gaps were in advanced cancer care. And so these are what patients told us. They found there to be poor communication of diagnosis, confusion regarding the role of the family physician in cancer care, there to be poor care coordination among their care team providers, lack of advanced care planning discussions, as well as a misunderstanding of palliative care attributing to end of life or death. And so these findings provide an opportunity to be integrated into an early palliative approach to care. 8 months after the implementation of the palliative approach to care, which was the main intervention being early consultative visits with a specialist palliative care nurse, we were able to interview another set of patients and family caregivers to understand what their experiences were with early palliative care. This is what they told us. They experienced communication among their care team, especially with the facilitation of the early palliative care nurse. Patients and families felt involved and engaged in their care. There were availability of supports for coping, both informal and formal, as well as positive views regarding palliative care as really improving day-to-day and quality of life. We find that early palliative care did help to provide cancer care that is patient-centered, with an improvement in understanding, care coordination, trusting relationship with the palliative care nurse, increased involvement of a family physician, as well as advanced care planning discussions. Now, this study is the first in Alberta that is exploring the experiences of an early palliative care pathway from both the perspectives of patients and family members. Study findings are currently being used to inform this pathway and further implementation in the rest of Alberta, as well as expansion into other cancers as well. Thank you for your time.